welcome to the Mind Body Podcast, your rebellious podcast with me, your host, Maria, where it is all about a strong body, calm mind, healing, and fully living. And today I have an extra special guest for you, and that is Dr. Cuadrado joining us from Argentina. This is, you guys, my plastic surgeon. I have gotten a lot of questions around my surgery and around who my surgeon was. So look at that special treat. He will be right here with us today. Hello, Dr. Marcelo. How are you doing?
Hello, how are you, Maria?
I am great. I am so super excited that you're here and that you get to, share with us, I would say the reasons why I really picked you as a surgeon and to educate us a little bit more about, I really think about the art of plastic surgery and the type of things to pay attention to. When we pick a surgeon, recovery process, prep process, all of that stuff. Before we dive into all of that, let's give you an opportunity to get to know who Dr. Marcelo is and give us 3 words that describe you and give us like a little bit of a story behind each word.
Well, I'm a very big enthusiast of plastic surgery. I've been doing body contouring in USA, in Iowa City, with my mentor that was Ali. And the thing it was that I began and do like a rhino surgery. So at what time I feel that body contouring surgery now in the place that I work, that is the British Hospital in Buenos Aires, it was not so good. I feel like the abdomen, the surgeries, that wasn't like very good surgery. Said, this is aesthetic surgery. I don't feel so good about that. And then go to the United States to learn some tips and things that make all of my practice very satisfactory and have a very good results. The other word, enthusiastic. The other word that I have for me, I think, how can I say it? I'm a believer. Yeah, I think I believe in human beings. I have always in my consultation, in my office, I talk a lot with the patients. So I really worry about what happened with you. The thing that doctors lost in between decades I think in our type of modern medicine, it tends to not to hear the patients. So we are not like algorithms doctors that, okay, what do you have? Come in here. I have high blood pressure, so take this pill. I don't believe in that. I believe in, okay, what happened with you? Why do you have the high blood pressure? And why you don't before? So try to go before and try to get that solved. I think is in that. I believe in human beings that are excellent machines that could work with the mind and the body and try to heal. I think a lot of that. And a third, just me 3 words.
Just 3.
So
which one?
It's very difficult because when you talk with another person that say, okay, describe me with 3 words, and I said, you're like happy, you're a very good person, you're like funny. So I think I'm I don't know, artistic is the
okay
term.
Thank you. I was like, I sure hope you're gonna bring something about your creativity and music into
Yes,
it.
I'm artistic. I always, since I was a little kid, I always want to draw and want to do things, but it's not about the plastic surgery about that. I always try to get solutions. So I play chess, and sometimes I go to my bed and dreaming about that game in chess that I cannot solve and how I solve it. So I like to solve things. In every case, I have to make the things working out. So when I have a patient, I'm thinking, how can I solve this? Is that what the doctors do? Yeah. You know, in plastic surgery, we have some techniques and we have some, how do I say it? We have some surgical skills that we could use to make a surgery. We mostly use a lot of things that get in our work together. Okay. So it's not like, okay, you learn from me, you are my student, and then you're going to do the surgery just the same as me. No, I'm going to give you the
foundation.
Yes, the foundations, and then you're going to do your work as you do. It's going to be your skill of work. I think that plastic surgery is not only a technique, like when you do appendectomy, or like when you do a liver surgery, or the stomach that you do a gastric bypass. That is only a technique that you have to shrink the stomach and do a bypass with the intestines. So plastic surgery merged a lot of techniques that you have to think, and then you have to think about the patient, chose what technique you're going to do, and then figure it out that what you wanted to have like the best result.
And I will tell you that I'm going to bring up a couple of points to what you talked about. The first is that you believe in humans. And I mean, I've shared this with you, and I've shared it with a lot of clients, because they're like, why did you go all the way to Argentina? And I shared with you that I had a couple of consultations locally with plastic surgeons, because I had my surgery, corrective surgery, 13 years after I had my baby, my C-section. And I went to these consultations and I felt like I was just a number that was just like, okay, you need this. Okay, we're going to do this. Okay, any other questions? Bye. It was like so rushed and so matter-of-facty, versus when I did 2 big consultations with you, and you really gave me your time, and I had a lot of questions, and you took the time to answer each and every question with a lot of depth, a lot of information, and a lot of food for thought. So that was one. I really felt like you looked at me as an individual who is going to go through this big process and surgery, versus or that's going to go, through your process. And then the other thing is, and again, I've shared some of these with some of my acquaintances and friends and clients, is when I was in pain in the first couple of days, and I was like, I don't like to take medicine. I like to go through like mindfulness and natural aspects, but I was like kind of desperate, and I was like, would you just give me any medication? And you were like, Maria, your body knows what to do to heal. Medication is not good for you. You're not going to get that from a lot of doctors, I will tell you that. And I just love that about you, because what I tell my clients is that our bodies are so beautifully designed that they know what to do to heal, if we give them the right setting and environment and opportunity, and support them through the healing process. And I just absolutely love about that. And then the other thing you just brought up is that you look at each patient as an individual, and as each patient is a different case, and you're using your skill set, and I would say your intuition maybe, to what can I do, what tips and tricks can I do for this particular patient to deliver the best results and to execute my vision. And I really think there is art to that. Sometimes my clients tell me like, wow, like, how did you design this session? How did you know which exercises to give me? Because I think as I'm working to a client, what part of their body needs to work right now? And I think part of that is intuitive. And I love that, you know, even when we talked, you were like, well, let's do this and let's do that and let's do this. And I mean, I trusted you, you know, with whatever you recommended. Like, I feel that, like, okay, this is somebody who is going to tell me what's the best in my interest, somebody who has a vision. Let's go, Dr. Marcelo, into what are some things we should ask if we're looking to get plastic surgery and where we're selecting a physician? I mean, I shared some of the things which were important to me, but as a physician, what do you tell to somebody who is going to go have plastic surgery? What should they look for in a plastic surgeon?
I think that plastic surgeons, as doctors, as other specialties, we are human beings too.
Of course.
So it's very particular from whatever plastic surgeon that you're going to see in a consultation, that sometimes there's plastic surgeons said, okay, what do you want to do? Okay, oh, let me see, I'm going to do that for you, and this, and this, and that is that the surgery that you're going to have. I try to not to do that, never. Always ask the patient that what you came for, what you want. Mm-hmm. So if I can figure it out, what you want, so that is the time that you're going to free in my office. You have to feel free, and you have to leave all taboos about being nude or something, and tell me what is worrying you that you have to came to my office to get a solution for that. So wow, I don't know what happened.
I have no idea. Fireworks behind you. This has never ever happened. But hey, you said something brilliant. If you're on video, there were just fireworks. If you're on audio, we had fireworks.
I love fireworks. But that is the, I think that is the first thing that you have to know. You have to hear the patient, what is really worrying, because sometimes you're going to do something that the patient doesn't want. I have some patients that came with other surgeons that said to me, okay, I do this surgery and ask for the doctor that I want to have better breasts. I want to feel more feminine. And he put me 500 cc's in each breast. That I don't like it because it's too big. And I said, why do you don't talk with the surgeon prior to the surgery? Ask him what you want. Mm-hmm. Because if you don't tell the doctor that what you want, it's very difficult to other person that try to imagine what is inside your head. So I think you have to feel with the doctor that you're going to do to the office. You have that intuition. That is the person that can imagine what I have in my mind. Right. So you have something in your mind. You want something. You have to tell him, okay, I want that. It's that possible? You could do that? Because sometimes not all the surgeons have all the techniques, all the tips, or do that kind of surgery. So sometimes he said, okay, I do this, simply that. But with information about internet and social media, you can look all of the surgeons and say, okay, I mostly want that. That is what I want to have in my body. So is that possible? Okay. So I think that the chosen, one of your questions was how to choose a plastic surgeon. First, I think that it's going to be a plastic surgeon. So you have more in your country. You have to be board certified. You have to be in a society. If you check about the social media that he do some courses that is really official course that do with other plastic surgeons, the place where the plastic surgeon do the surgeries, everything counts in that. So, but it's more about feeling with the surgeon in every respect, with the bone doctor, with your clinic doctor, with your pediatrician, with everyone.
You have to have the good feel for what they're doing.
Yes. Because sometimes you're going to the top doctor and the top plastic surgeon and go to the office and you feel like he doesn't care about me.
Yeah.
He treat me like really bad. And you don't have to do it. You don't have to do anything in that place. It's
right.
not your place.
If you don't have that connection and safety, I would say safety, because surgery is a big deal. And that's how I felt. Until I met you, I had really put that, I was like, okay, maybe I'm just not going to do that. And then when I met you and I started seeing your work on social media, and when I did the consultation and really loved the way that you answered my questions, I started, talking to my husband and saying, hey, I really like him. And I really started seeing, and then I was like, I don't know, a different country, So then we did the second consultation and I had even more questions, and you just really made me safe. I mean, so safe that I took a plane and, did this in a whole different country, which I had never visited before. So, I wasn't sure what the conditions are.
Do you like Argentina?
I love Argentina.
I know.
I do have to say, part of my concern was, and I asked you that, like, what are the conditions in the hospital? Is it going to be clean? You just don't know what you're getting yourself into. And those are legit questions and big things for me. And I was very impressed by, the way people, like the professionalism of the entire team that was there, not just you, but the way admission was, the way that my care was post-surgery, the nursing staff, even though some of them didn't speak English, they were so caring, so supportive. Like, your anesthesiologist, like we chatted and laughed. I mean,
yes.
They held my hand when I was like, I don't like needles. And you were like, you got this, I mean, like those little things when you're going through something big like that, they make a huge difference into how you feel and expectation and your experience. So to me, they're a big deal. And then, of course, you did an amazing job with my surgery, which, that is huge. And let's talk a little bit about the preparation for surgery. And then obviously you specialize in body contouring, but then also the recovery process, because I will tell you, I've interacted with a few women and some of them, they're like, let me show you my scar. And their scar looks like, ooh. And then they share kind of like horror stories about their recovery, and they really had the surgery and they were just like, okay, bye. Like there was no plan for recovery. And you were like very like, after you do the surgery, this is what you have to do, this is what you have to wear. There was a very detailed plan of action for what needs to happen after. So can you talk to us as a surgeon, what is the importance of preparing your body before and after surgery and following plan for recovery, optimal recovery?
For every kind of surgery, you have to be, I think it's less swelling, if I could say that. That's what is that? If you're going to do a surgery, or it's like you're going to do like 40K running. Oh, yes. 2 days before, you're not going like drink and have some heavy food and spicy food. You're going to be okay, prepare, eat healthy food, drink only water. You're going to be like more
intentional about how you take
yes, more healthy for the surgery. It's prior to every surgery that you're going, I think that you prepare and be okay, don't drink. For every type of surgery, more plastic surgery, because you swell a lot.
Yes.
Because mostly of the times, despite if you do like a blepharoplasty or like a lifting or tiny zones of surgery, if you do like a big surgery, you're going to swell a lot. So the best is that you keep your health in your food and your preparation always.
Mm-hmm.
The other thing is mostly different kind of surgeries have different kind of preparations. So if you have like a big abdomen and more voluptuous, you use a garment to put it together, do a diet, run, do exercises to prior the surgery to be healthy and go for the best as the best time or the best body that you're going to have. Mm-hmm. So the post operation is going to be good. If you don't do this and you smoke or something, it's not going to be so good, and you're going to swell, and swelling causes a lot of pain. You have to take the drainage. I think it's more in that place, the prior of the surgery. Then the post surgery, I think it's mostly we tend to do this type of mindset of the people not to get in the bed. You know, you remember the time that I give you the that you're going to your house and said, okay, walk, don't stay in bed, go only in the bed just to sleep.
Yes.
Stay in the sofa, stay in the kitchen, walk a little bit, not do some long distance walk, two tiny walks. It's okay. Keep walking, keep straight, and then it's good because when your body's in movement, you know, the body is, all the cells are fluid. And if you get in stay in a stay position in the bed or lay down, the body stay and the cells too. So you talk about the medication. I think medication sometimes works as triggers for your body, you know? Okay, I have to heal one part of my body, but I don't know which trigger do I have with my mind, do I have to choose? So I take this pill and this is that. Say to my mind, okay, now you're going to heal. I think it's more in like that. Because, you know...
Like mentally, you mean?
Of course, but it is proven about microphotography that if you stimulate parts, you know, acupuncture is it's okay with the needles that you put in the body.
Acupuncture, yes.
Acupuncture. When you stimulate some parts of the body, they in Asia knows that about millions of years ago, that if you stimulate, then your body go to the receptors of the pain and get and liberate all the endorphins to heal your body. So sometimes all the people think that I have to take this pill and that pill and that pill and that pill. It's not about the pills, it's about the solution that you have to in your body. So your body in a post-operation is going to heal if you want or if you don't want, but it's going to heal okay.
Yes.
You know?
Yeah.
Sometimes we have to do some arrangements and and we have to clean the wounds, and that kind of external of the skin, how do I say that? External of the skin that you have to work.
Yeah.
Yes, not to get in an infection or something like that. That's okay, it's logical. But from the inside of your body, if you feel okay, the post-operation, you have to walk, you have to do like the same that as you do, but a little less.
Yeah.
Yes.
And I do have to say that I did get a coaching from you as I was in pain. I don't know if you remember it during one of my visits. And you actually did some mindset coaching for me, which I thought was ironic because I was in pain. And you were like, you have to think positive, right? Which I think, once again, it's very different to get that kind of advice from a physician. And I knew you were right. It's sometimes when you're in pain, right? You're like, okay, I don't know, I'm getting, I can get in my head, right? And you were so great in saying, let's think positive. I was having a tough time not being able to move and being dependent on my husband to even get out of bed, right? For somebody who is very independent and active, that can be very challenging. Each time you need to go pee, you're like, can you get out of bed? And then you go, it's a lot, which I can see how, people or like aging people or people post-injury, how that gets into them mentally. And then because of the pain and the discomfort, they don't want to do anything. They just want to sleep because they just want to give up. And yeah, and you talked about
but you have to, I think you have to use your pills, your painkillers or something like that, but not abuse.
Yes.
Use it when you feel pain, not use it all the days. Sometimes you say, okay, you have to use it 4 times a day. No, it's not 4 times a day. Only use it when you feel like a lot of pain because it's swelling, because it's okay. And then you're going to be okay. But yes, you have to use it in a post-op surgery. But I think that the meaning of this is that don't abuse about the pills.
And you
only
did
use it.
Yeah, and you did give me 2 painkillers, and you said, okay, this one is the one you take. This one is like in extreme cases, if you're in like unbearable pain. And I asked you, I said, okay, do I go to the second one? And you're like, how are you doing? I was like, well, I think I'm okay. I'm in pain. I never opened that second, stronger medicine painkiller that you gave me. I just
yes.
So yeah, but I mean, I do think having that support from you and just saying you got that and reinforcing that, and you were like, a couple of more days and you're gonna feel better, like keep walking, just reinforcing those little things which makes such a huge difference was so part. And I think that also goes back to the relationship that you have with your doctor, because I mean the first couple of days are rough.
Yes, I know.
Yeah, so well, I love that.
But you pass it.
Yes, you do. It's just when you're in the midst of it, you think like, oh my gosh, like, is this ever going to be okay? Right? The days seem really long. Those 24 hours seem really long. So
yes, they're long.
Well, I am very grateful to you for everything that you have personally done for me and for making time. You are a very busy physician to be here with us and to share your knowledge and wisdom with us. And do you have any piece of advice you want to share with us?
I think that mostly of the people that want to do some kind of surgical procedure about plastic surgery, they try to think that it's like more how do you say it, vanidos, like for being like perfect, or for being like more for the beauty, or for being like, I want to be like that. I think it's not like that. It's like a self-esteem surgery that you could do it, and it have a very good results. And sometimes they are, as you see, not so tragical procedures that you're going to be like 3 months in a bed in the hospital. You do a surgery and you feel good, and it's more for self-esteem, and it's more for you. It's not for the people, it's only for you. And if you want to do it, it's okay. If you don't want to do it, it's okay too. But the thing is that think about what you wanted to have, not only do a surgery because of the social media asks you or tells you that you have to be like a Kardashian or something like that. Sometimes mostly of the people said, I want to be like that. No, you're going to be you. And if you want to improve something, here we are, the plastic surgeons, to do that. If we can do it, and it's okay. I think that plastic surgery is now for every human being that want to be more happy with itself.
Yeah, and I mean, I will tell you, for me, that was 100% true. I was not trying to look like anybody. I was self-conscious about what I had, the extra skin that I had, and like I said, I knew it was a big surgery, so I did not take it lightly. And I'm so excited. I'm still swollen. I'm so excited to see the final results, because I can already see that my so-called kangaroo pouch is not there. So I'm so excited. So
yes, I know. You're perfect.
You know all about that. So
yes.
Dr. Marcelo, where can people find you if they have questions, if they want to schedule a consult? What is the best?
They can write me. I have my Instagram that it's at DrCuaDrido. That's Dr. Cuadrado. And you could write me, and I happily answer all of your questions, and I'm here. So,
and I'll tell you guys, he will answer your questions. He was amazing in answering. I can be annoying with my questions, and he was very diligent in responding.
No, it's okay. You're good. You're great.
Thank you so much again for being here with us. If you guys have any questions, please don't hesitate to ask them out. Of course, if you prefer to reach out privately to Dr. Cuadrado, or even if you have questions about the surgery that you would like to ask, I have been very transparent through the whole process. So definitely let us know how we can support you through making the right decision personally for you, so that you can, if you're considering of something to do something for yourself, you can make a yes or no decision. Again, thank you so much, Dr. Cuadrado. Thank you guys for tuning in.
Yes, I'm sorry, my English is not very good, so I'm sorry about that.
No, you did amazing.
Thank you for your invitation, and thank you for everything, my good friend.
Thank you, my dear. Thank you guys for tuning in. Remember to stay rebellious. We will see you next time. Can't get enough of those rebellious conversations? Do make sure you subscribe, like, and share with your friends.